tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real stink. I had intentions to call it sick, but I end up in Jolly's Pharmacy. And down in the street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work and be on any mission. If you see me walking, Jolly's Pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up your immune system, Jolly's walking. Yo, Dominic is the white water box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
It is 19 minutes after the hour of 10 Eastern Caribbean time. Good morning to you and welcome to Health Vibes, your very own talk show brought to you by the brand you trust the most, Jolly's Pharmacy. We are so happy to have you with us yet for another episode every Wednesday at about 10:15 until 11:30. We are happy to have you, and when I say we, it means that I'm not alone. My permanent co-host is right there with me, and I know you've been seeing her and you're wondering, but hey, she working at Jolly's now, man. She must be working at Jolly's. Yes, she's an honorary member of our team. Trudy, good morning to you.
Good morning, Carlton. Good morning to the listeners of Q95 FM Radio and the listeners of Health Vibes, of course. Yes, Carlton, I'm a Jolly's affiliate.
Yes.
And I've been for a long time. People know that is the brand that I support. And they'll always see me with the Jolly's brand. So they may be used to it, but they're getting used to it by now, Carlton.
I think so. Yes.
Yes. But it has been quite a busy week.
Yes.
As I was just telling you before we went on, Friday was my first time at JP North, and it was quite an experience. The enthusiasm and the level of support of the customers in the North for Jolly's, it was amazing to see on Friday at the MVP shopping experience in Portsmouth. Yeah.
Well, I had a clinic there last week, Thursday,
uh-huh.
And the reception was extremely overwhelming too.
Okay.
That I had to really cut off the clinic by about, well, when I say cut off, I mean stop, taking clients by about 12 o'clock. Because I recognize maybe all 3 o'clock I would still be there screening.
Wow.
But again, the people, the people of the North rather, they've really been supportive and appreciative to the Jolly's brand there, and we are truly thankful. So I heard that it was really an overwhelming experience at the MVP.
Yes,
and we were happy to have brought that experience to the people of the North. On Saturday, we had the
Megaland, I
Children's
looked, I
Day.
saw it was also well
Yes.
patronized. Yeah.
And the weather was quite favorable to us, too. It was
Mhm.
extremely humid, but at least it
At least
did
it wasn't
not rain.
raining.
Yes,
Yeah.
yes. So the children and the parents truly had a good experience there. And again, was very supportive to that initiative. And we really want to thank you, all the people of the North, for really having some good time with us last week. That would have been Thursday,
Thursday, Friday, and Saturday. Yeah.
those 3 days there. But
Mhm.
it is our Customer Appreciation Week happening as we speak. We actually began in Portsmouth from last week, and that continues until Saturday of this week. Today, Wednesday, yesterday, we had long lines of people signing up for the
Prestige Day was
cards
yesterday. Okay.
because you were getting double points.
Right.
Any of your
right.
purchases from since you get your card, you make your purchase, your double point is already applicable.
Carlton, I saw some customers asking if the Prestige card is the same as your loyalty card,
It is the same.
where you get the points, right?
Yes.
So I was grudging that I could not shop on Tuesday yesterday
Yes.
because I always use my card and I always look at my points carefully because I'm trying to
Yes.
get to the time to get my reward. And, because I was working yesterday, of course, I couldn't come down, and I had made purchases on Saturday, and I was like, boy, if I could have just held
I
off for
know.
Tuesday, I would have gotten double my
Yes,
points.
yes,
And I
yes.
am looking at my
Yeah.
points carefully, Carlton. I don't play with my points.
I know. I agree with you. I have points at one of the supermarkets, and it's the same thing.
Yeah.
Sometimes I say to my wife, "Why did you go to that one when you know we're not getting points?"
You know what I
You know,
mean?
go to the one where we get the points. So we get serious about that point business.
Right.
But today, Wednesday, we're having live performances at different branches, and we have a flash sale today, Wednesday. A flash sale means that it's a sale without notice.
So you
It
just
can
have
happen
to
at any time.
you just have to be there and be lucky.
That's it. That's why it's called a flash sale.
Yes.
And so we're having one sometime during the course of today, where
Uh-huh.
the system automatically changes for a period of time, whether it's 1 hour or 2 hours, and then afterwards the system reverts to the original price
Okay.
right away. Everything is
Okay.
so smartly done
Mhm.
these days, and so that is going to be happening, and that discount will be that flash sale will be applicable to all branches. So
Okay.
whether you're at the mega store, whether you're in Portsmouth, whether
King
you're
George
at
Fifth
Great
Street.
George, whether you're at King George, it will be applicable.
Nice.
And if you were at the State College,
It would apply too.
It would have
Okay,
applied as well.
okay.
So any of these branches that you are during some time of today, that when this flash sale will be actually commissioned, then you may end up getting some big discounts.
All right. So you
today.
just need to
You
be
just-
there.
You just need to be there.
You just need
Maybe
to
I
be
should maybe I would tell you, maybe bring your pillow and take a little nap, go sit down and take Wi-Fi and
Camp.
because
Camp
Wi-Fi
at
everywhere
Jolly's.
at Jolly's. So maybe just stick your Wi-Fi, go to Mega, sit at the cafeteria, have
Right.
something to eat and drink, use your phone. You're having Wi-Fi for free. Call your family that you haven't spoken to in England or wherever, and you're there.
Right.
When they announce it, you are there.
You're there.
already.
That's a good
And you have
plan.
your trolley in your hand,
That's a good plan,
Yes.
Carlton. That is if you off here today. Don't
If you're off.
don't show
duck,
up for
don't
work.
duck, don't duck.
Don't show up for work and say Carlton said.
On Thursday tomorrow, we are having our big health screening
Mhm.
or big preventative health clinic, and that is going to be happening at the Jolly's parking lot in Roseau. And you're wondering where that parking lot is. We are on Castle Street. I think it's called
Mhm.
Castle Street.
Yeah.
That is the street close to the laundry.
Yeah, the
dry
laundromat,
cleaner.
the dry clean.
Right.
Mhm.
Like
The
if you're
Lynn's
going
Dry
to pay
Clean.
a Domlec bill,
Behind
we're
Domlec.
right
Mhm.
at the back there where Domlec Administrative Office used to be. That street there, you will see a big parking lot with a big gate. The gate will be open for sure tomorrow. It will be well decorated. We'll have tents under there, and we'll be doing all screenings for you for absolutely no cost. And again, we will be showing appreciation by giving some tokens, not to every person, but to some people. And there will be some commission. There will be some vibes. I'm not going to announce what merit you're going to get the token, but we will have some tokens to give away. Again, everything is complimentary. Jolly's Pharmacy. You not all you have to do is sit and wait. You will be screened. You'll get to know your numbers, your blood glucose, your blood pressure, your body fat percentage, which is extremely important. Your body mass index, right? Your weight, your height. Um, what else? Practically, these are the tests that we'll be offering tomorrow along with consultation.
Okay.
So we are open, and we're saying to you from tomorrow at 9 a.m. 9 a.m. the clinic begins until there about 1, 2 o'clock. And that is going to be happening on Castle Street. And that is the street that is in the proximity of Macmillan gas station and the dry cleaner, Lynn's dry clean, I think it's called.
Right.
Right? If you're going to pay your Domlec bill, that's straight at the back there. That's the area where the clinic is going to be held tomorrow from 9 o'clock. So we expect you to be there. We expect you to coordinate yourself in a respectful manner, no rushing. Everybody will be served, and at the same time too, you will be well seated. It's not going to be no confusion. You'll be under tent, so even if there is some drizzle or
You'll be
some light
sheltered.
rain, you'll be sheltered, and you should be fine. Tomorrow afternoon, we are having our very special customer appreciation cardio jam. So those of you who are huge fans of Cardio Jam, we began Cardio Jam many years ago. We are having it on King George, the Fifth Street, that is close to the Point Michel bus stop, that vicinity there, that road there. This area will be cut it off,
Okay.
and we'll be having the Cardio Jam there with special accompaniments, you call it? Special music by one of the top bands in Dominica. So expect to have real fun. Expect to start thinking of Rise and Wine. Expect to start thinking of Creole Music Festival. Expect to, yes, you exercising, but you are
Having
a
fun.
lot of fun.
But so Carlton, you're not telling us the band then.
Oh, no. So you have to come and see for yourself. Walk with your rag, walk with your sneaker. Make sure the sneaker is not squeezing you. Right? So you want to and make sure it's not rubbing, it's not, to give you any zampood, as we would call it. So good sneaker, your bobby socks, dry fit outfits if you have that, maybe your cap, sunglasses, and then the sun sets a bit late, your rag, and you are good. There will be samplings and stuff like that. So you will be fine. You will be fine. The cardio jam is going to be taking place from 5 p.m. to 6 p.m. So it's 1 hour of power, 1 hour of cardio power.
Nice.
Yes.
With a top band,
Yes.
but not revealed as yet.
Not revealed as yet.
Okay. All right.
That's it. On Friday, it is the
MVP,
VIP
shopping experience
experience
at Mega
edition
in Fokole
from 5
p.m.
to 8 p.m.
Right.
So, you want your massage?
Mm-hmm.
Maybe you want to have a little conversation about makeup.
Mm-hmm.
Maybe you want to know something about your hair, what might be the best product that is applicable for your hair.
Mm-hmm.
You will get that. Maybe you just want to sit and have a glass of wine,
Right.
and listen to some sax music.
Right. Enjoy a nice ambiance. It's a
Right.
Friday evening.
Yes,
Mm-hmm.
you can get that.
Mm-hmm.
Maybe you want to hear something a little hotter and you want to dance in the aisle. you can do that as well.
Mm-hmm.
So we have a wide assortment of services that we are going to be offering to you come Friday at our VIP experience at the Mega Store in Fukuli, and that begins from 5 p.m. to 8 p.m. And truly, I suspect you'll be there again.
Yes, yes, yes. I don't miss the VIP shopping experience. Yeah, that's my vibe.
Correct.
So I will be at
Is mom
Mega
going to come?
on Friday. I'll invite her. I'll make sure she's invited. But everybody should, if you're in the area, particularly if you're like me and Mega is your favorite branch, you like the nice, spacious atmosphere of Mega and you're always at Mega Friday evening, you should also turn out at Mega in Fokole, JP Mega, for the VIP shopping experience. I know last year people enjoyed it. I know last week Friday people in the north
Yeah.
enjoyed it. So there's no reason that it won't be enjoyable for you on Friday evening.
And you really can get some good stuff at the cafeteria. Scooby,
Yes.
our main chef, trust me, he's awesome.
Mm-hmm.
And on Saturday, we are bringing down the curtains with our Megaland experience, Roseau Fokole edition, happening in the yards of the mega store in Fokole. Again, it is an activity that is totally free for children and as well accompanied by an adult or parents, where you can bring your children to really have fun. Not just have fun, mingle, develop new relationships and friendships. They might see one of their peers from school that they've not seen. It seemed like school closed so long
So long ago, yeah, I know.
but they may not have seen that friend in about 2 weeks, and they'll be so happy to hug and run and kiss that friend. We always engage them in some competition, maybe singing competition,
Mhm.
dancing competition, that type of thing. So we are doing this coming Saturday, that is July the 20th, and it happens from 2 p.m. to 6 p.m. That is children's Megaland experience happening at the Fokole branch this coming Saturday from 2 p.m. until 6 p.m.
Nice.
Yes.
I remember last year as well. It was huge.
It was.
It was huge. So I expect the children to really come out and the parents to really come out and bring them this year as well.
Definitely.
Mhm.
And as we maybe just go through, as we just went through, let me just again congratulate the Catholic Church
Mhm.
on tomorrow's what do you call it in
The new bishop.
yes,
Yeah. The
ordination,
ordination of
right, the
our new
ordination
bishop.
of the new
Mhm.
bishop from the Bahamas.
Mhm.
On Sunday, we were told by the parish person in Kenfield
Mhm.
that they're expecting 15 bishops from throughout all over the world that should be there, and over 300 and something guests coming from overseas.
Wow.
So it should be very, very,
Very big.
big.
And with they're using the cathedral,
Yes.
although it's not complete, but I've seen pictures setting it up nicely for that ordination on Saturday.
Yes,
Mhm.
on Saturday. Actually, I
Mhm.
received an invitation to attend on Thursday afternoon. I'm hoping that I might be able to attend.
To attend.
On Thursday, that is tomorrow afternoon, on the ordination of the new bishop of Roseau. So, what we are going to do, we're going to take a short break, and then we will basically get into our discussion this morning on health vibes. Stay tuned.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday. So be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real stink. I had the intentions to call it sick, but I end up in Jolly's Pharmacy. And down in the street, Jolly's fix up my immune system. Me feeling fit and strong, now I'm ready to work and make on any mission. If you see me walking, Jolly's Pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up the immune system, Jolly's walking. Yeah. Yo, Dominic is the white water box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy, then boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real stink. I had the intentions to call it sick, but I end up in Jolly's Pharmacy. And down in the street, Jolly's fix up my immune system. Me feeling fit and strong, now I'm ready to work and make on any mission. If you see me walking, Jolly's Pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up the immune system, Jolly's walking. Yeah. Yo, Dominic is the white water box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy, then boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
All right, so we're back with you this morning on Health Vibes, and this morning we are going to be discussing an area that may be considered a bit sensitive, but we felt it is quite relevant to discuss, and that is prescription drug abuse. I have been a pharmacist for 27 years and counting, and I can tell you that though we may say in Dominica, we don't really have a major prescription drug crisis like some of the developing countries like the UK, US, Canada, and so forth, where many people are addicted to opioids. And you see them on the streets like real zombies. And sometimes I've seen situations and I've heard of situations where they even, you know, put guns on pharmacists demanding that they get the drug because of their addiction. And so this morning we are going to talk about some drugs that you have to be very cautious with when using, and sometimes hence the reason why doctors may give you a limited amount. Sometimes you might say, well, I'm not sleeping, I've not been sleeping, and you find yourself almost addicted or abusing sleeping aids. We've seen people who even have abused and overused laxatives to lose weight,
To lose weight,
especially
yes.
women. We've seen people who have used cough and cold medicines and they liked the fact that it helped them to
To
sleep,
sleep, yeah.
and they became addicted to the cough and cold medicine to help them to sleep. I can tell you that when one of the medical schools, with one of the medical schools that has been around, we've seen situations like that where students actually became abusive to medicines. We're talking about legitimate medicines.
Prescription medical,
Yes.
or over the counter.
And they became paranoid that they just need it
They need
by
it.
any means
Yeah.
necessary. Even when I worked in Portsmouth, I remembered a student trying to bribe me, to pay me up to 700 US dollars. I remember that very well, to get tramadol.
Mm-hmm.
You understand?
Mm-hmm.
And to get tramadol would pay me way more than the cost of tramadol, just to get that high. And then if you don't watch those things, when you just give the invitation to that, it never stops.
Right.
It never stops, and then
Right.
you see what could happen. So we are going to be discussing this a bit.
Prescription drug abuse. Carlton, it brings up, as you mentioned, this person trying to get that drug from you. It also brings up the whole concept of ethics in the medical
Right,
practice, both
yes.
pharmacists and doctors, because we do know too that sometimes people do get addicted to prescription medication, or
Yes.
people do abuse prescription medication. And then there is the ethical consideration. Do you, as the practitioner, who can sense maybe that there is an issue of addiction or abuse, do you continue to provide, or do you what if the money is offered? Do so I know this is also it's maybe a separate discussion, but it's also interesting, because as you mentioned the scenario that you did, I remember a series that I watched and I was telling you about it, called Painkiller, on Netflix, where it highlighted the opioid crisis in America at a certain point, and how these physicians, doctors, were prescribing these drugs because there was a financial benefit to doing it. And so the crisis was really thriving on poor ethics in the medical community as well. So that is a whole maybe other discussion, the ethical considerations of of the medical practice as it relates to drug dispensation.
Very true.
Mm-hmm.
And I love the fact that you've just injected ethics in there. And in medicine, that's an entire course.
Right, right.
Forensic pharmacy and ethics. But prescription drug abuse is a social issue. It is a medical. It can become a medical crisis. We've seen many people succumbed. We've seen celebrities succumbed to the abuse of prescription drugs, having mixed them up and all of that. We've seen and we've heard of young people, dying from overdose of prescription medications. But prescription drug abuse is the use of prescription medicine in a way not intended by the prescriber. So that is the catch line there. In a way not
Intended by the prescriber.
by the prescriber.
Mm-hmm.
So you were given, for example, diazepam or Valium, which is considered almost like a hypnotic, a drug that helps you to calm down and to stay cool and to induce sleep and all of that. But then you were given for 1 week one pill to take each night for 1 week. But you went on your own and you took 5 pills. That was what was prescribed to you. Right? So yes, the drug was prescribed, but not in that dose and direction.
Right.
So in a case like that, that would be considered a prescription drug abuse.
So not used in the intended way.
That's it. That's
in
it.
the intended
And we
amount.
see things like that happen a lot.
Mhm.
And that is why in the primary healthcare system, pharmacists often ask clients to bring back your empty bag. They often.
Oh.
So it's a way of almost tracking to see, right? Because and that's why even when we document, when we process prescriptions, before we file them, we scan them, but you will see. So if you dispense diazepam 10 milligrams, one pill to be taken at night for 1 month, it's quite obvious we'll dispense 30.
Mhm.
So that 30 will last you for 30 days.
Mhm.
Is one at night.
Mhm.
But then by the 15th, you back to me and telling me that
You need a
you
refill.
need a refill,
Mhm.
then I have to question, but you should have 15 more.
Right.
So what happened to the 15 that you should have in that bag?
Right.
You understand?
Right.
So
Right.
we see things that are happening. But what makes it even more complex is the fact that people go to different prescribers.
Ah,
So you
different.
have
Okay.
doctor shopping. So you have that person could have seen Dr. X on Monday, would have gotten a prescription for diazepam, and that doctor could have given it for maybe 2 weeks. Okay, then Wednesday, they decide to go to another doctor and say to the doctor, well, you know what? I'm not sleeping. The doctor doesn't know that they went to a doctor on Monday
Mhm.
and was given diazepam.
So that doctor also
Right.
prescribes.
So
Okay.
you see it.
And then also to Carlton, I guess they could go to different pharmacies.
Right.
Yeah.
So you have it on different systems. So if you
Right.
were to come to Jolly's, we would immediately intercept that and said, but wait a minute, Monday I filled a prescription for that patient. They went to this doctor, but here it is. Today, Wednesday, we see in another prescription for the very same drug
From another
from
doctor.
another doctor.
Mhm.
Something doesn't seem right. And so we see situations like that. And the people sometimes, as we said, can be very, very clever. Because even for us, you might find that is why when a prescription is given, the pharmacist under the law has the right and privilege to write on that prescription
Mm.
and sign. You must sign that prescription. So if I have this, if for example we scan the prescription that was given to us, and but you say to me you want a copy of you want your prescription back, well we've scanned it, so it's on our system already. But once I have dispensed that particular drug, particularly once it's classified as a control drug, I will cross it out entirely and put my signature and ensure that I made note that all of the supply
Was dispensed. So
so even if you were to go to another pharmacy with that original prescription, it should not be honored.
right. So Carlton, right. So that leads me to a question I did have for you, and I did hear you just mention it. I just wanted to bring it out. So there's a list of controlled
Yes.
drugs or controlled substances that the pharmacist would be looking out for.
Yes.
All right. Okay.
We do have that list.
Okay.
And currently, the Ministry of Health has initiated a logbook. So all pharmacies would have a logbook for controlled drugs. All these drugs are not, they are in the dispensary but under lock and key.
Okay.
And every time these drugs are dispensed, they must be logged into that book. And only a registered pharmacist can sign that book. At the end of it all, somebody from the Ministry of Health, I think specifically dealing with pharmaceuticals, comes in, I think the chief pharmacist, and balance off the book and see if it matches what's in our inventory, what we ordered, because we have to
Okay.
get special license for a lot of these drugs.
Okay.
So
So
drugs
there
like the
are checks and
barbiturates,
balances
right,
in place.
like drugs like the barbiturates, like
Mhm.
if you take in phenobarbital,
Mhm.
that is one of the drugs.
What is that drug for?
We use it for epilepsy.
Okay.
Right? So if you're using that drug, that is one of the drugs that must be documented.
Okay.
Codeine,
Okay.
right?
It's for
Tramadol,
pain
yes.
medication.
Morphine,
Mm-hmm.
pethidine,
Mm-hmm.
fentanyl, um, let me see what else. Ritalin,
Okay.
Adderall,
Ritalin is for
right,
ADHD.
right,
Okay.
right. Concerta.
Mm-hmm.
We have let me see what I'm missing. Diazepam, lorazepam,
And those are sleep
all,
aids.
yeah, right.
Okay.
All the diazepams, they're part of that. So
And Valium?
yeah,
And
is
Valium,
right.
okay.
Yeah, it's a benzodiazepine.
Okay.
So oftentimes we sometimes have to use our discretion too to even when as a community pharmacist you know your clientele. Dominica is small, you know your clientele. So at times a doctor may prescribe and sometimes it can be we can even call the doctor. We're supposed to call the doctor, particularly if it's not dispensed, it's not it wasn't prescribed by a specialist. So, for example, if it wasn't prescribed by a psychiatrist, then we may have to call. So, if I get a prescription for, let us say, diazepam 10 milligrams 3 times a day for 3 months, then that would kind of concern me.
Mm-hmm.
What exactly are we treating with that diazepam?
Mm-hmm.
Why that prolonged use of it? Why that dosage? So I have that right to call the doctor and inquire if I
Okay.
feel uncomfortable with it.
Right. And
No,
it could have been an error in
right,
writing as well. So you
right.
want to make sure.
Now that same drug, the doctor could be using it for a skeletal muscular issue too.
Mm-hmm.
So that person may have had, let's say, a pinched nerve, and he may choose to use a benzodiazepine to help to relax the nerve, right? So it's not necessarily just for sleep, but I would have need to understand the rationale why you want to use that particular drug when there are other drugs that could be used, and you have to weigh and balance the habit forming nature of that drug, how you can end up being addicted to that drug versus other alternatives that may have a much lower probability or propensity to get you addicted to. So you have
Mm-hmm.
to weigh and balance. Now that same patient, I could say, well, I'm going to sort of titrate this, and I'm going to give that patient 15 days at a time or 30 days at a time, so that we can monitor,
Mm-hmm.
right? Because what if that same patient who has that chronic skeletal muscular issue is also severely depressed and may have suicidal ideations, and the doctor doesn't know that,
Mm-hmm.
and decide to take an overdose of this drug? What
Mm-hmm.
happens then?
Mm-hmm.
So it's very sort of perplexed.
Uh-huh.
But we as pharmacists, and maybe that's an eye opener for many people who listening to me, may not even be aware that we have to look at all these things.
Yes, yes. It's definitely interesting information because you might just think the pharmacist is reliant on what the doctor has prescribed,
Mhm,
but the pharmacist does have a lot of thinking to do
mhm,
in just filling out a prescription. It's not just automatic as you've explained. Carlton, I wanted to ask you though, what you did mention some drugs, of course, and you mentioned a lot of them controlled
mhm,
drugs. They are habit forming. They can be habit
mhm,
forming. So if somebody is prescribed a particular drug on this controlled drug list,
mhm,
you mentioned, your diazepam, for
mhm,
instance, for the first time, that is their
mhm,
first prescription.
mhm.
Would you, as the pharmacist, in filling it out, advise or mention that this drug is
Habit
habit
forming.
forming? Would that information be given to the client, or would it be assumed that the doctor would have possibly explained that?
Mhm. And that's an excellent question. It is the responsibility of the pharmacist to
Mm-hmm.
give the client all of the critical, relevant information relating to all medications. It's
Okay.
not merely the responsibility of the doctor. That is where the pharmacist, who is trained in pharmacology and understanding the dynamisms of how drug works on the body and how the body works on drugs, pharmacokinetics and pharmacodynamics, those two terminologies. Um, the pharmacist, it is your responsibility to do so. And yes, with all controlled drugs, even at Jolly's, we have an auxiliary label that would be stuck on
Okay.
that medicine to let you know it can cause addiction. So you want to use it cautiously. We've seen cases where people have had severe traffic accidents
Mm-hmm.
with several broken bones, and they would be prescribed opioids to
Mm.
control their pain. I had a friend who told me he became practically addicted for the couple of, I think, 2 months or so he spent at the hospital until they recognized that he was developing a serious habit,
Mhm.
wanting the drug, and he was given pethidine. They were giving him pethidine injection, and he told me it was making him feel so nice. He was
Right.
feeling a nice high,
Mhm.
and yes, the pain was gone, but he had a lot of good energy, and it made him feel like almost like a Superman
Mhm.
kind of a feeling. And so and he told me straight up, he was really, really liking it. He became, he kind of liked the way it was making him feel. And these drugs, yes, they are great. They can really manage your pain, but we have to let you know this is what can happen. And so even at times when the pharmacist may make may decide to make a phone call or make a decision, it's not merely to hurt you or to prejudice your actions, but to really protect you from some of the major adverse effects of these drugs. And we're talking about, as we said, strong painkillers like the opioids, like, so we mentioned things like pethidine, morphine, oxycodone, these types
Mhm.
of painkillers. The anti-anxiety drugs. So we're talking about Valium, Paxil, not Valium, Xanax, um, um, I try to remember some of them. But most of the benzodiazepines, lorazepam or Ativan, right? Most of these benzodiazepines, they can really make you feel like, I have had people, it's like they were in the pharmacy and they were shaking and crying because they wanted Valium so bad that
Mhm.
they feel like if they did not get a Valium tonight, they will die.
Right.
And you know that is a situation that really requires psychosocial therapy.
Mhm.
That person needs therapy. Why are you not sleeping? What is preventing you from sleeping? Taking the drug is only pacifying or masking the
The issue, yeah.
main issue.
Mhm.
And that's what happens with addictions. A lot of the times it makes you feel good for now, but then at the end of the day, you are creating a monster. So the same thing happens with sedatives and stimulants. We're talking about stimulants like the anabolic steroids that a lot of the
Ah,
wrestlers would use,
okay.
for them to gain a lot of muscles. We call them stimulants. So
Mhm.
these types of stimulants, they can be very, very dangerous too, because they can affect your heart muscle, and they can also too increase your testosterone levels that can, especially if there's prostate cancer in your family, increase your risk to prostate cancer
Mhm.
as well. So yes, these drugs are here, but we have to be very cautious with them. We're talking about even Ritalin and even pseudoephedrine, a simple active
It's
ingredient,
in cough syrup
pseudoephedrine.
and
Yes,
cold
the
medication.
decongestant.
Okay.
Yes, in the US now you cannot get this active ingredient over the counter.
Ah.
You see,
So,
because people were getting addicted to it.
so Carlton, that leads me to another question. There are certain pain medications, at least I know of one, diclofenac, that is not, you need to ask for it
Mhm.
at the dispensary. You cannot just pick up a bottle like you pick up a paracetamol bottle on the shelf. So is for that painkiller, for instance, is there also a perceived habit forming possibility for it? Is that why it's put, or is it just the strength of the drug why it's not on the shelf?
It is not a control drug. It is not a drug that really works on the central nervous system.
Okay.
But because of the severe adverse effects that this drug can cause, particularly peptic ulcer,
The gastrointestinal
right?
system, yeah.
Bleeding of the inside of the stomach,
Okay.
right? Issues to your kidneys. They
Okay.
can damage your kidneys if they are misused,
Ah.
right? So because of these major complications, we always advise people to be cautious with using non-steroidal anti-inflammatory agents where this drug actually falls in that class,
Ah,
the
okay.
NSAIDs. But it's not habit forming. Like most of these habit forming drugs that we're talking about are drugs that really work on the central nervous system
Okay.
by impacting certain neurological transmitters, particularly dopamine, which
Mm-hmm.
is the make you
Yeah.
feel good transmitter.
Mm-hmm.
That is the same transmitter that makes you feel sexual
Mm-hmm.
and make you have an orgasm.
And unhappy.
Right.
Yeah.
So it's that same transmitter that is affected with crack cocaine, if you or
Yeah.
heroin or this kind of
Right.
these types of
Makes
drugs.
you feel extremely good. So that's
Right.
why the feeling has to be pursued because it's a great feeling.
That's it.
Mhm.
That's it.
Mhm.
So that is why these drugs are often dealt with very cautiously. And so if we see prescriptions, that kind of what we call the red flags prescriptions, and we've seen them sometimes because there are some doctors sometimes who um, may in a very maybe not very professional way sometimes may prescribe some of these drugs and um, with certain quantities that may be questionable.
Right.
We would look at it as red flags. We look at it as red flags. I remember there was a client too that was using a particular drug for pain, and when we looked at the system, I mean, you could see clear cut that was a prescription drug abuse situation, and that person was really accessing doctor to doctor to doctor and getting large quantities of the drug over and over, and may not have recognized that it was the same system we have.
Right.
And so you would find they'd go to this particular doctor on Monday, get that lot of the drug, then go Wednesday, get another portion of that same drug, and then maybe go Saturday, get another portion. So you find that person would have a large
Quantity
amount.
of the drug.
Yes.
Mm-hmm.
And then what happens now? When that drug is in this person's hands, who really to monitor whether they're taking that drug, let us say, as prescribed, 1 3 times a day or 1 twice a day. But the person might decide, I'm going to take 2 3 times a day or three as a dose 3 times a day when I feel like, because I just want the pain to be gone and creating a bigger monster. So these things happen, and we see it a lot in the elderly. Believe it or
Ah.
not, yes, the elderly, especially those who live alone, those who are widowed or are widowers,
Mhm.
those who may have returned home after residing overseas for many years, and their children do not reside with them because many of them are very lonely. They tend to suffer a lot with psychosocial issues.
Okay.
So they have difficulty sleeping. They have anxiety at night. When nights come in, they feel afraid because they are alone. Sometimes they feel very lonely. So they would often, go to the doctor and say, well, this is what is happening, and be given these drugs. And oftentimes they can misuse these drugs to the point where they become dependent on these types of drugs. So we want people to be again um, very, very, very cautious with these drugs, because some of these drugs, they do have major adverse effects. They can, yes, they might make you feel high. They can increase your level of alertness. They might give you irregular heartbeat. They can increase your blood pressure or low down your blood pressure. They can affect your appetite. They can affect your sleep. They can, make you almost do things irrationally.
Yeah, erratic behavior.
Yes,
Mhm.
erratic behavior.
Mhm.
You could find yourself just taking up all your savings and doing nonsense with it. And if you were in a normal state of mind, not under the influence of any prescription drug, you would have been making better choices.
Mhm.
So we see things like that happening a lot. And not forgetting too that some of these patients are also on other medications,
Right.
which can cause drug interactions.
Mhm.
And so that is another major issue that we see with the misuse or abuse of some of these drugs.
Yeah, Carlton, I suspect we should give the numbers. I know
Yes.
some people may have questions
Yes.
and want to call in. So of course you can get us on 449-3095, 449-3096, 449-3097, or 616-4257. If you're calling from overseas, you can reach us on 305-432-9624.
Yes. So what we're going to do, we're going to take a short break. We don't have any callers right now, but if you do call, just stay on. We're going to take a short break, and I'll be right back.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Woke up this morning feeling real stink. I had intentions to call it sick, but I end up in Jolly's Pharmacy. And down in the street, Jolly's fix up my immune system. Me feeling fit and strong now, I'm ready to work and make on any mission. If you see me again, Jolly's Pharmacy is number one. Jolly's Pharmacy. We cater for everyone. Jolly's Pharmacy. Boost up your immune system. Jolly's Pharmacy. Yo, Dominic is the white father box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
So we are back with you on Health Vibes. It's 9 minutes after the hour of 11. I think we have a caller.
Yes, we do.
Good morning to you, caller. Thanks for calling.
Good morning, Mr. Carlton, and good morning to you.
Good
Good morning
morning.
to you.
Good morning.
Yes. I like you're talking about the drugs there. I know there were clients that were on pethidine for pain, and they keep taking the pethidine all the time. The doctor had to stop that because, they get addicted to it. And some of them want to insult the doctor and nurse for not giving them the pethidine. But they were getting addicted to it and they just couldn't do without it. Even when they don't have severe pain, they want pethidine. And it's not advisable. And there are other drugs like morphia. Well, morphia is rare. People don't get so much addicted on morphia, but mostly on the pethidine and the glyco. What we have now, another one, a new drug for pain, glycosenic or whatever. They just get addicted to it and they can't do without it. So we have to, sometimes the doctors have to explain to them why they shouldn't be taking these drugs so often.
Yes.
Because they will not do without it, and they don't want to go to bed unless they get those drugs. So I'm just saying that to tell you what is happening.
Thank you very
Yes,
much,
thank
caller.
you.
Thank you. And oftentimes, these are the people that will come and tell you they lost the prescription. What you gave them, you dispensed to them on Monday. All of a sudden, they can't find it. It seemed to be gone, or a child may have misplacedly threw it in the garbage, and you get these types of. And we have. And we trained how to deal with these issues, and we see the irritability. Usually, if someone has inadvertently lost the medication and they were to come back to the pharmacy and say so, and depending on the drug, the pharmacy says, well, honestly, we really cannot refill the prescription without having a new prescription. Once the person remains calm and say, well, fine, okay, that's okay. But once the person begins to get extremely irritated and want to insult you and want to almost tell you, well, okay, if you don't give it to me, look like I'm going to die, you want me to die, you know for a fact
That is a sign.
that's already a sign that something doesn't. You too. It's like you're too desperate. Something doesn't seem right. Most people, if you're rational, you calm, you will say, "Oh, okay, well, no problem. I understand. Let me just call my doctor. I'll just go back to the office and let the doctor know what happened." You understand? But once we see that type of emotion, it already alerts us. And oftentimes they try to negotiate a lot with you. As I was saying, coax you, or sometimes even try to bribe you and tell you, well, I could pay $200 for it. I could, I
Yeah, it
could.
doesn't matter the price.
Yes. We see that a lot too when the cruise ship season opens.
Wow.
Yes, we see that a lot. Many of the tourists, they will tell you that, they will come casually and tell you, do you have, for example, do you carry oxycodone? I'm like, yes, we do, but it requires a prescription. Well, I'm in pain and my wife forgot the medication and this and
Oh,
that. And
wow.
they will tell you, and you'll tell them, well, really, and they will tell you, well, we've been to Mexico and we got it and we didn't have a prescription. I'm like, well, this is Mexico. Their their laws might be different from us, but you need a prescription, and the prescription has to be from a local doctor there, and whatever, whatever. And they will
Interesting.
try to tell you all kind of things. Well, what if I pay triple the amount? And yeah,
Interesting. So
yeah,
you
yeah, yeah,
see,
yeah, yeah,
so,
yeah.
and so it's
Mhm.
interesting, Carlton, listening to those experiences
Mhm.
from you, and I guess from pharmacy in general, and how similar it is. Well, not it's the same as how an addict
Yep,
to illegal
that's
drugs
very true.
behaves. So you see the same sort of irritability when somebody is addicted
Mhm.
to, an illegal drug, or another drug, not a
Mhm.
prescription drug, but another drug, and they can't get it. You see the same sort of bargaining,
Mhm.
negotiating, begging, desperation. So the signs are pretty
Yes.
same. They are the same. The signs
Mhm.
are the same, actually. It's just, I guess, if we see certain signs from somebody, let's say a vagrant on the street, somebody we know
Yes.
addicted to
Crack was.
crack or something, but if we see it maybe
Mhm.
in a well put together looking
Mhm.
person, we might not pick up as readily, but the
Very true.
pharmacist is trained
Mhm.
to pick it up.
Very much so. And I mean, we deal with these things. I mean, I've dealt with these things for many, many years, and I can tell you that um, sometimes it can become out. It can get out of hand when you hear of stories, because oftentimes, if these people, if the situation is not contained, they become very violent,
Mm-hmm.
abusive. They can harm others and themselves, right? They could end up losing a lot of what they own. You understand? They will find ways to try to get through the system by manipulating their way through. You could manipulate other healthcare providers. You could manipulate a doctor. You could manipulate a nurse. You could try your best to manipulate into the system to get through. And oftentimes they don't even want to hear the rationale why the drug cannot and should not be dispensed at this time. To them, they just need it because they will die.
Mm-hmm.
This is that going to this is what's going to be happening to me. Oh, we have some callers. Good morning to you, caller. Thanks for
Hello,
calling.
morning, Carlton and Trudy. How are you all?
We're doing
Morning.
quite well.
Okay, just one question I wanted to ask. If you have a doctor, please, and I'm talking Dominica generally, worldwide, because you know you have some people with money, they can bribe a doctor to give them certain prescription.
Yes.
Now, if you see a pharmacist notice that, is there anything the pharmacist can do? Can the pharmacist call the doctor and say, well, I notice you're abusing that. Is there anything you all can do? Or is this the doctor and the patient? You understand what I'm saying?
Yes.
Okay.
Interesting.
Very good question.
Yes.
So let me just say to the public that the pharmacist is not controlled by the doctor. Okay? And yes, the doctor works along with the pharmacist, then the pharmacist works along with the doctor, but the doctor cannot control the actions of the pharmacist. So if I were to receive a prescription from a doctor and I analyze the prescription and I find that the prescription is irrational for whatever reason, whether it's the dose, whether it's the regimen, meaning how it should be taken, whether it's the route or something, I find um, irrational about that prescription. The first thing that the pharmacist does is call the prescriber and say, well, I have this prescription. These are my concerns relating to the prescription, and there is this exchange of information. Now, if a doctor were to say to me, well, so why are you calling me for? That's what I want for my patient. And the doctor has this arrogance and would not even want to listen to my own concerns. I'm not obliged to fill that prescription.
Mm-hmm.
Yes, you wrote the prescription. I am not obliged to prescribe to fill that prescription. The reason why, if I have my main responsibility is to the patient. That's my first responsibility,
Mm-hmm.
to ensure that when I weigh and balance this which is in front of me, what is the outcome? Is there more benefits to giving it, or more side effects or complications?
Mm-hmm.
That's my first thing. Now, if something were to happen in let's say I decide, you know what, in any case, I'm going to give it, and something happens to that patient, under the law,
It's on you.
the pharmacist,
Yeah, it's on you.
it's on the pharmacist, not the
Yeah.
doctor. Yes, the doctor prescribe it, but you as the expert in drugs, you should have.
Yeah, and you dispensed it. So
That's it.
mhm.
So the doctor cannot control the action of the pharmacist. Yes.
Okay.
Let's take this caller. Good morning to you, caller.
Hello, good morning.
Yes, good morning to you.
Morning.
How are you all doing?
We're doing quite well.
Okay, nice. Just a question about a colon, liver, kidney cleanse. Can you just pick up one of these at the vitamin store? Healthy living, like if you can, someone just pick up something like that to use by themselves without a
What for what purpose?
A cleanse, a colon
cleanse
cleanse.
your colon, liver, kidney.
Well, it depends on several factors. I mean, is there any underlying medical conditions of concern? So, for example, a patient like that may have end-stage kidney failure. Then you may not be able to use um, many of these products because of the high levels of sodium that's in them. So, for example, using citroma and you have end-stage kidney failure, you're on dialysis, you're going to elevate your blood pressure right away. So it depends on some of the underlying medical conditions that person may have, including diabetes and high blood pressure, and it depends on the preparation of that medication that is going to use. The best thing to do is to consult a pharmacist. If you're going to make a decision, we'll be able to ask you the relevant questions and would guide you accordingly.
But I think
Okay,
she's
so-
asking to if it's prescription or if it's
It can be over the counter,
okay.
but not because it's over the counter, it's not a drug. It's still a drug. It's just
Yes,
that you
yes.
don't need a prescription for it, but it is still a
Oh.
drug and it can still have side effects and adverse effects.
Okay, like in case of the person did what do you call that? Some test that they did that you can put your hand over and then they can scan your organ, and then that test would include that you have to do a detox or cleanse and all of that.
Well, you see, these types of tests, they have a lot of controversy with them.
Mhm.
You know, I think most, if you were to speak to most doctors who really believe in hardcore science, yes, technology may have some benefits, but if you look at most doctors, when they send for tests, they either do an invasive procedure, whether it's a scan, whether it's an X-ray or something, or they do blood tests to find out exactly what's happening. I have heard of that particular device. As to its accuracy, I cannot tell you confirmatively whether it really works and it is accurate. I cannot tell you. I don't know the person who administer it. I don't know the level of training in terms of anatomy and physiology and medicine. I don't know. So I don't want to prejudice the process or the procedure. Neither do I want to prejudice the equipment that was used.
Okay, I understand. So it's best if the person has already started taking it, it's best they stop and consult.
That would be the better thing to do.
Yes, definitely. Definitely.
Yeah. Okay?
Okay, thank you
You're
so
welcome.
much.
You're welcome.
You enjoy the rest of your
Thank you
day.
very much.
You're
Yes.
welcome. Bye-bye.
Yeah. So we had two very good questions there, and oftentimes that happens, and that is why we will use our discretion to determine what amount is given. So there are some drugs that cannot be repeated. For example, if a doctor writes a prescription for, let us say, Ritalin, there cannot be no repeats on that prescription.
Ah.
Right. So if the prescription is for 1 month, it is 1 month. And then the patient has to go to get a new prescription. Cannot be given for 3 months and at one time and so forth.
Okay.
No. It is, and there cannot be refills. Okay? So there are some drugs that has a lot of strict policies relating to them. There are some drugs too where, especially these drugs, Ritalin, Adderall, and so forth, where it is recommended psychiatrists and pediatricians are generally the first line
To prescribe.
them.
And Ritalin, as we had mentioned, is for ADHD.
Right.
And Adderall is for
The same.
ADHD as well. Yeah. Okay.
We want people to be, yes. Good morning to you, caller. Thanks for calling.
Yes, good morning, Carlton, and good morning to Trudy. Great program.
Thank you. Good morning.
I work in a rehab most of the times. I work in rehab. And Carlton, let me tell you, the people who are addicted to these drugs is very bad. Very, very bad. Carlton, they know the time. They know how many drugs they have to get. And if that time reach and they don't get that drugs, they hand on the light, pouring in. They're making noise. They're even calling the 991 for the police, saying you refuse to give them the medication. When you see they're addicted to that, when you see they're addicted to the drugs. And what they do sometimes, they hide the drugs. Hide it. You're supposed to give it to them and let them take it in front of you. But sometimes they refuse or put it there because they know what they want to do. They hide it. And sometimes when they have 3-4 of them, they take it.
And
it's
they get,
very,
they
very,
have
very
an
bad
overdose.
thing. People are addicted to the drugs. Great program.
Thank you.
Thank you.
Thank you. And that's why psychosocial evaluations must be part and parcel when we see these patterns, because again, the abuser doesn't even recognize that they're abusing.
Right.
The drug, they just assume that they're taking the drug to make them feel better, but not recognizing that it's more than just a physiological pain. Their pain could also be infused with emotional pain too. Let us say that you were in an accident and you lost your leg. Yes, you spent maybe a month in the hospital and were given these drugs and they helped you, but then you've lost your leg and you have to adjust. And then you've never dealt with the therapy, the psychology of losing a leg. So then you're depending on this drug, yes, to take care of a pain,
but the psychological impact is also important. Yeah.
Let's take this caller. Good morning to you, caller. Thanks for calling.
Mr. Carlton.
Yes, sir. Good morning to you.
Good morning, Judy.
Good morning. Good morning.
Okay. You know, I already have some interesting questions to ask you. Carlton,
yes, sir.
Another question I would like to ask, and it has to do with the teenagers. You know, if a young girl gets pregnant, right, and she goes to a pharmacy, or she sends somebody to a pharmacy to get these sort of tablets that could get rid of the unborn child. Do you all ask them questions or do they have to go and see a doctor first? Because there are some tablets, I don't know, I might be wrong. There are some tablets over the counter that you can use come and that for pregnancy. So I want you to enlighten me on that. Thank you.
Okay. So we're straying a little, but I will answer your question. Firstly, once someone has confirmed that they're pregnant and they require, let us assume that they have decided to have an abortion, that is a conversation that they should be having with their gynecologist, not their pharmacist. Now, if somebody comes to the pharmacy seeking a drug that may induce the the termination um, of a pregnancy, that we would have to refer the person back to their OBGYN, the gynecologist. There are medicines that can assist in these situations, but they are not merely designed for that carefree purpose. So, like everything else, if there is a medical emergency that warrants a, a legal abortion, these drugs used by the gynecologist can assist with this. But there is no over the counter drug that is sold at our pharmacy
Correct. Yeah.
that can induce or is promoted for such actions.
Or
I
is
must say too that over the past maybe 6, 7 years, I personally have seen less people, way less people, come in and ask for any type of drug for that action than many years ago. And that happened since the advent of
Morning
the
after
morning
pill.
after pill, the pill 72. A lot of women now are using injectable birth controls
Contraceptives, yeah.
or the coil and so forth. But in reference to that, we refer them to the gynecologist to have that discussion and the way forward relating to that
Yeah.
that request.
Yeah. So interesting. But yes, and you know the legality of it is also not
That's
there. So
right,
so
right.
that is also a legal discussion. But yes, Carlton, it's interesting how we've discussed so many things, but the takeaway is how many things have to be put in place to safeguard people from themselves,
That's
essentially.
it.
And it's important for people to understand that some of these rules, regulations, some of these things you mentioned that pharmacists must do, the questions that must be asked, the checks and balances that you mentioned have to be put in place. That is to safeguard you, you the patient, you the client, and so people should accept, because I do imagine there must be oftentimes kickback
Oh, yes.
against some of these things that you've mentioned that you must do, questioning the prescription, for instance, or refusing to fulfill it if you find it's not, it doesn't make sense, or there is some sort of issue. So I can imagine the the people maybe upset, or why are you in my business, or why this that. But it's really to safeguard the people, to safeguard us, from potential harm that we can cause to ourselves from the abuse of certain drugs.
And that is the reason too why it is important that all pharmacies receive the signature of any doctor that is registered on island. That includes dentists, that includes veterinarians as well, because veterinarians do prescribe medicines too. And you could find very well a vet prescribing a drug, and it may not be for an animal, but
Wow.
you're not familiar with that vet signature. and it comes on a government prescription pad, and you go ahead and you dispense it and you don't know. And we have these issues where many doctors, we still do not know who they are, merely because many of them are young. They just came back from studying, they're working at maybe the government system, and we do not know, we're not familiar with their signatures at all. And that's one of the major problems that we're having. It is something that I personally have tried to address, speaking with previous people before in the ministry, letting them know that it is really, really important that we get those signatures. We know who these doctors are. So, in cases where we have a contact, we know their signature, because oftentimes we get prescriptions and let us say it came from the hospital. We don't know which doctor, we don't know which ward, we don't know nothing. And sometimes you have to tell the patient, honestly, there is nothing. We have to verify things on this prescription. We don't know who to call. You may have to go back to the hospital, which is going to take time. The person may be not well, but that's just how it is. We cannot guess. We cannot just assume. So we really, I will take that opportunity to really say again, if anybody from the Ministry of Health or the chief medical officer office is hearing, we really need those signatures. We need, if it means that we have to start all over again, and any doctor, all the doctors that's in the system, we get a copy of their signatures. That is very, very, very important. I'll give you an example. A couple of years ago, when I worked in Portsmouth, I remembered receiving a prescription for some drugs, which included tramadol. And then when I looked at the prescription and I saw the letterhead on that prescription, the signature just did not match. So that was the first thing that I saw. I said, hey. So I excused myself a bit and I called the doctor and I'm saying to her, look, this prescription I received, blah, 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 and stuff like that. And she's telling me she doesn't know about that prescription. She never wrote no prescription for the day. She's on holidays. Right? So somebody got her prescription pad and wrote a prescription and came to the pharmacy to get the medicine.
Wow.
You see? But if, let us say, I did not know her signature, I could have just accepted it.
Right.
Because I don't know her signature. And so that is why it's important. We know that, okay, the medical board has reviewed this person's credentials. They are now
registered doctor.
Yes. We need a copy of that person's signature, their full name, and a contact number.
Right.
Just in case something happens, we want to verify something, we can verify right away.
Right.
And that is one of the major problems that we're having. And it means, you see now, a window can open for many things to happen.
For fraud, yeah. So, and with the expansion of the medical service,
Right.
Because I personally, in the time of in my career as a lecturer, so many of my students are doctors. So in this, in this past 10 years, let's say, there has been so much new entrants, so many new entrants to the medical service. So I can imagine, how important it is to keep that database up to date and to keep those signatures, keep that information up to date with the pharmacists. That is very important. That is a very good point.
As well. The labs need the signatures too. When requisitions are sent to the labs, you don't know. Right. The labs need it. The pharmacy need it. The insurance companies need it as well. When they're processing claims, Social Security need it as well.
Right.
So you see all these places there, the signatures are very, very important to us, so that we can ensure that it's protected, and anybody can just write a prescription anywhere, and next thing you don't know, we can say in Dominica China Friendship Hospital that if is not enough, or Roseau Health Center, type in RHC, that's not enough. We need the actual name of the doctor and a contact number on our system, So we need to get that organized.
Nice. Carlton, we
We're
out of time.
Yeah.
Yes, we're out of time. I just want to say, I just want to say thanks for listening to our Facebook and YouTube viewers. Ivinia Joseph has been saying that it's a great program and that you are her favorite pharmacist, Carlton, and continue the good work. So thanks for listening, Ivinia, Patricia Fountain, Veronica Pascal as well. And it's the end of our time, but it was
Yes.
indeed a very, very interesting discussion.
Very interesting discussion. So, again, from all of us here at the studios of QFM, we're saying good morning to you. And as always, your health is indeed your greatest resource. Preserve it. Have a good morning. And Friday, we're going to be celebrating with you our Customer Appreciation Week. And I'll be giving some giveaways this coming Friday on Jolly's Market, if God spares. Take care, everybody. Have a good morning. Bye-bye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With health